So I'm Janet Currie. I'm from Princeton University's Center for Health and Wellbeing. I study early childhood and the effects of public policy on early childhood, mostly in rich countries. And I've been really enjoying the conference and learning more about how this research is being carried out in developing countries. I think there's a lot of room for coordination between people working in different areas because after all, the core issues are the same, child development. So one of the things that I've been really concerned about is the importance of health, and often those things are kind of siloed. We have education in one silo and health in another silo. And what I'm learning is increasingly how interrelated those two things are. It's kind of a cliche to say that children can't learn if they're sick or malnourished or anemic, but it's really true. And a whole other dimension that doesn't get as much attention as it should is that a lot of early health problems play out in terms of higher propensity to have mental health problems, which of course are very highly related to education and employment outcomes. So one of the things that I've looked at a lot is the effect of environment, both broadly defined and in terms of pollution on child outcomes. And the reason I got into that, I actually started off doing what you might think was more conventional, thinking about, well, if it's child health, then I should look at medical care. And of course, medical care is very important. But what I realized is that children get medical care after they're already sick, normally. And what you really want to do is prevent them from becoming sick to begin with. And the things that are going to make them sick are very wide-ranging, such as child abuse or violence or pollution. So the paper I was talking about here was about lead poisoning, which I guess is very topical in the US with the water crisis in Flint and all these kids unfortunately being lead poisoned. There's a lot of sources of lead that are less regulated in developing countries, lead from industrial processes, lead from batteries, still lead from gasoline. And what I've been showing is that even at very low levels that are found today in the US, you're still finding a very significant effect on aggressive behavior, getting in trouble at school, juvenile delinquency. And so it's quite sobering to think about kids in developing countries who are being exposed to the same things and presumably with similar sorts of effects. So one of the takeaways from the work on rich countries is that even very low levels of pollution have significant negative effects on children's health, their physical health, their mental health, also things like violence and aggression. So if we think that there's a lot of developing countries with much higher levels of pollution, not only China, which gets a lot of press, but places like India, Indonesia, Mexico, and then other places that have more local but high levels of pollution, there's a lot of children who are potentially being damaged. So that's kind of the downside, is that there's a lot of damage being done. The upside is that it's not so difficult to think of remedying that and reducing the pollution, which would then have very big positive impacts on people's health and also on their outcomes like education, labor force participation, and so on. So one of the things I think is really interesting that's come out in economics and other social sciences in the last 10 years is the understanding of the importance of the fetal period to future outcomes. And in some ways, although we spend a lot of time talking about 0 to 3, it might be that -9 to 0 is a lot more important than 0 to 3. And that would have huge implications for policy, because that would mean that we can't wait until children are born to try and intervene. If we want to intervene, we should really be trying to intervene with their mothers. And if you want to reach mothers in early months of pregnancy, that means basically you have to reach young women of childbearing age. And so that really puts a whole different perspective on policy aimed at reducing intergenerational transmissions of inequality.